Okay, good morning. My name is Dr. Anthony Ezepue. I've been called upon to make a presentation. Our first topic today for this noble setup by my younger sister, the O Care Health Group, is to talk about first aid tips and strategies for assisting the elderly. Um, I'll start by defining first aid in a simple layman's term. It's just the immediate care given to a victim with an injury or illness. So the key principles would be to prevent further injury, to preserve life, and to promote recovery. I must have to say here that once you acquaint yourself with the basic skills needed for performing a good first aid procedure, you get more confident and you be more calm in situations that you find yourselves moving forward. Um, Now we're looking at the contents of a first aid kit. I remember when we were growing up back then in Nsukka, my mom had a little cupboard where she put in, there you have your iodine, your methylated spirits, you had gauze, you had cotton wools, and all those things. As a child, you dare not want to go there because you know that you're going to be walking away in pain when you injure yourself. So basically, for the first aid, we can improvise. You can get any box, that is easily secured. I guess that people may be able to buy this sort of boxes from the pharmacy shops or even from the supermarkets. I don't know what is obtainable there in Nigeria, but essentially you want to have different sizes of plasters, steroid gauze for dressing, bandages, scissors, safety pins, disposable gloves, and you can have even more depending on your scale. For us to be able to understand um, the difficulties the older people face, we will need to understand the basic changes that happen as they get old. So it's called the physiology of getting old. Things start to slowly reduce in terms of the ability of the cells to withstand shock, stress goes down. Um, our body starts to fail us as we get older, essentially. So the eyesight becomes a problem. Skin becomes thinner. So underneath the skin, you have a fat layer. As you get older, the fat layer diminishes and you become prone to having bruising because the fat layers prevent the blood vessels from easily breaking when you hit your skin on something. As you also get older, you start to develop all these other medical problems, so ranging from diabetes, uh, hypertension, heart problems, and that will put you into a more difficult position too as an older person. You generally have decreased function in your muscles as the motor functions, and also even the muscles of eating and drinking also reduce, and your reflexes also fail as you get older. So with that, you find that older ones are prone to choking, depending on the bite size of what they eat. So with that in mind, it would help us to be one or two steps ahead, knowing the difficulties they face and the likelihood of having problems as they get older, and we can be ready to deal with any problems that may arise. So measures to slow down these physiological changes would be, again, exercising. So it's very, very important for the elderly one to stay fit, okay, exercise regularly. So I think the onus is on us to keep encouraging them. It's not usually easy to get motivated to do these things when you've hit the 60 mark or 70 mark, but we have to keep pushing them because not only that this would help them physically uh, to get fitter physically, it also helps them mentally. So because as you exercise, you find that um, the body secretes a hormone called endorphin. So it's a good hormone, a feel good hormone. When the body releases that, it helps reduce the way the brain sees pain. So essentially reduces pain and makes you feel better in yourself. So please, if you don't take anything away from this, please take this away. I always encourage them to move about. Now, for some people who have problems with their mobility, there is chair-based exercise regimen that one can adopt. I don't want to go into it a great deal in this particular session, but I think it'll be a topic for another day. Um, I'll be able to illustrate with pictures things that can help our elderly ones stay active and stay healthy as long as they can be. Okay, so again, because of mobility problems that can happen as one gets older, muscles becoming thinner. Um, it's very, very important for us to be aware of the different things that can be in their way and cause harm as they go. So hazard awareness is very, very important, and prevention of these would also reduce the ability of our elderly ones, our loved ones, sustaining injuries. So key things would be looking at the environment. I know that it may be a challenge in some parts of Nigeria, or depending if where you are, if you're in the third world or the developing world, you may find that basic light, electricity, and all those things may not be what you get easily. And but as much as possible, ensure that the place is well lit. Um, Declutter. So clutters are something that would always lead to falls, trips, and accidents. So make sure that the elderly ones, as they um, where they live, if it's a common room or the living area, make sure they've got clear passages where things aren't sticking out so that they can easily mobilize without having a fall. In the kitchens also, make sure sharp objects like knives aren't sticking out too, because if they sustain a fall, they may fall into a knife or sharp object, and that can be a problem. Keep an eye on their furniture. So beds, worn out beds or wobbly beds could lead to a fall, assuming they're trying to get out of bed and it shakes. They may fall from there. Same with chairs. So please, if you can, replace those. Look around. If these places have got rugs or wet surfaces, get rid of those and take care of those. The other thing that I have to stress here is the footwear. Now, I remember my grandmom. I don't think I ever saw her wear a pair of trainers, though they go to the farm with a pair of slippers, and they're prone to having nail injuries or that injury or cut. I know that they grew up not wearing these sort of things, but as children, we have to encourage them, buy these things and tell them the importance of having a proper footwear that would at least eliminate or reduce the ability or their potential of sustaining cuts or puncture injuries. For sprains and strains, so sprain layman term would be taking a knock on your elbow or your joint, or stretching of the ligaments or things that hold down the joint. Um, on strains could be a pulled muscle. So if someone has sustained that, your loved one has sustained that, try and stay calm, apply some ice. So when I say apply some ice, I don't want people going on, using direct ice on the skin, because that can burn. So it's very, very important to wrap the ice. So for some of us here in the UK, we will wrap up a frozen pea bag with a towel and place it on top of the injured area or the sprained area. You can put that on for about 10 to 15 minutes, up to 3 times a day. It helps with reducing the swelling and also helps with reducing the pain. Protect the injured area. You can use comfortable bandage, support bandage. Rest the area. As you rest the area, it helps increase the amount of blood supply going to that area and helps healing in general. Remember to keep the elevated, the limb that's affected elevated. That also helps in reducing the swelling. Depending on how bad things are, please seek further medical attention. In the part of the world where we live, we can easily go to the hospital or go to an emergency center. In some parts of Nigeria, I know that the first port of call for most people would be the pharmacist. So again, you may just visit them first if you don't want to go to the hospital, because they may have more knowledge at that point to pass and then move it on. For cuts and scrapes, so clean the wound. So if it's a wound, clean with you clean the wound with clean water. Now, if you have a running water, you may prefer to use a running water on top of the wound, because that puts a bit of pressure on it and helps to take out any anything that can be lodged in it, little particles or debris that can be lodged in the wound. If the wound is bleeding and you've got a pair of a bandage at hand, use that bandage, put some pressure, but put a bandage on it and apply pressure. If you have got a bandage, you can use any clean cloth that you find around, put some pressure on it, elevate the limb. Depending if it's the leg, you can put one or two pillows or a cushion just to keep the limb up. That will reduce the amount of flow, blood to the area, and reduce the bleeding. If it's a heavy bleeding, please do add additional bandages on top of what you've got, an additional cloth, and put a pressure. Please don't go removing the initial bandage or the cloth that you've put on it, because that will lead to more bleeding. All right. Sometimes people can sustain injury where you've got a foreign body embedded in the wound. Please do not go taking off the foreign body, because the foreign body may actually be holding down the bleeding. So try and put pressure around it, not on top of it. Don't remove it, and then seek further medical attention. This will be going to the hospital, so that you can see the emergency practitioners who will be able to remove whatever is lodged in there in a safer environment. Again, eyes to bruising. If they've just sustained only bruising, usually take about 2 to 3 weeks to settle down. Okay. For falls and burns, again, once we take care of the little things that can lead to falls, hopefully there won't be a lot of things happening. But if your loved one, elderly one, has sustained a fall, they may, from the fall, have head injury or sprain or break a part of their body, a bone, a part of the bone. Um, if it's a head injury and you can see a clear lump, the person is conscious. Uh, Apply some ice. Again, same principles apply. Don't apply on ice directly on the skin. So you use some ice, allow them to rest. But you have to, because as we get older, if one sustains a head injury, they are prone to bleeding in the brain. So you bleed in the brain, and that becomes a problem. So for someone who has had a head injury, and likelihood of having had a bleed in their brain, you find out that as time goes on after the fall, they'll start to feel a bit drowsy, or you notice them becoming slightly more confused, or some changes in their own personality. So if you have anything like that, please, as a dire emergency, call for help and take them to the hospital, because at that point in time, they need proper evaluation by a doctor. If you suspect a fracture, so usually if there's a fracture, you find out that the affected limb may be a bit out of shape or distorted, or you get more swelling there. Try as much as possible to immobilize the area. So if you've got a cardboard, you may place it nicely and comfortably around the area, so that to hold it in place. You may use a bit of bandage also to hold it in place. If the patient is having a lot of pain, then you may just abandon that. You don't want to cause more problems trying to do that. Seek for medical attention immediately. For burns, so burns one can sustain from maybe uh, f- from cooking oils or even from direct flame. Cool the area under cold water for at least 10 to 15 minutes. If you notice blisters appearing, please do not break them. Try and cover with cling film. So most of us do have cling film. If we don't, get a clean plastic, cover the area, and then seek further medical assistance. Heart attack is something that happens everywhere in the world. I'm not very sure about the how frequent this happens or the incidence in Nigeria, but it does happen. Uh, the key things to be aware of and to suspect a heart attack is if your loved elderly one is complaining of chest pain, mostly just at the mid center of the chest or towards the left side of the chest. This pain usually is in the quality of they usually describe it as a pressure pain or someone sitting on their chest, or they feel they constrict someone is constricting them. That sort of pain is usually pain from the heart. So when it does happen, it can have pain going to the jaw, can also be going to the arm. If they mention that to you, suspect heart attack immediately and call for help. If you've got a phone, mobile with you, call for someone who can drive you guys to the hospital as soon as possible. If you're fortunate enough and live in an area where you can get in touch with the ambulance, do so immediately. Call the ambulance. So as you're waiting for help to arrive, you want to keep the elderly one in a comfortable position. So you don't want to make them feel panicky, because if they do so, it would worsen the heart attack. So you want to calm them down and just say help is coming. If you can lower them down to the floor and lean their back on a chair or on a table. When you do that, hopefully help comes and they can be taken to the hospital. That little maneuver and little period of trying to keep them calm may prove very vital at the end of the day. For stroke is also very common. I know it's common in Nigeria, um, and it's very, very common as one gets older. So stroke essentially is just a sudden death of brain cells. So when it happens, the typical presentation would be someone's face becoming drooping to one side. They feel weak in their limbs. They may have problem with speech, so it's difficulty speaking, finding their words, or their speech may become slurred. If you have anything like that, you have to. If you have anything like that, you have to call for help immediately. Keep them in a comfortable position. Please do not ask them to drink water or eat anything, because stroke would usually affect the area for drinking, and that could make them choke. Please remember that. Do not ask them to drink anything or eat anything. So there is a stroke awareness. It's called FAST. So for just lay people, just a lay caregiver to be, to be able to um, detect that someone is having a stroke. So if you look at their face, tell them to smile. One side will drop. The arms, you tell them to raise their hands up. That way, you notice that there'll be a drift on one side, the weaker side. If you tell them to speak, the speech may be slurred, or may they find it very difficult in getting their words out. Time is of the essence. In this part of the world, you usually call an ambulance, but anywhere you are, get someone if you can. If you can take them, rush them to the hospital. Okay. So for seizures, these are fits. They call them convulsions. That's how we knew them, as I knew it then as a child, as younger person in Nigeria. Um, So you find someone jerking, you know, he's lost consciousness and they're jerking, the limbs are seizing away. Keep calm. I think it's easy for me to say keep calm, but it's not usually easy when it's happening. So it may be easier for someone who, or you already know, that has suffers with epilepsy. So it may be easier because they may have had it before. So, but keep calm, let the seizure take its course. Do not try to revive the person while it's happening. The key thing is to look at the surrounding of the person, take away any sharp objects or anything that they can hurt themselves with. Put something soft like a pillow underneath the head if you can. Do not force anything into their mouth. Or I've seen people who have sustained quite terrible injuries trying to do so. Once it's safe to do so, when the patient stops seizing, try and turn them to a recovery position. The next slide will show you what the position is. So it's a recovery position where they're able, if they've had foams in their mouth or secretions, it would easily drain out without going to the wrong part of the breathing track. So if the seizure lasts for 5 minutes or more, please take the call for help and take them to the hospital. So if someone has a seizure, and this is the very first time the elderly one is having a seizure, you have to take them to the hospital afterwards, because they would need to find out the reason why it happened. Sometimes it may be down to a brain tumor, a cancer of the brain or something like that. So please don't sit them back at home because they've recovered okay. Seek for help. So that's the recovery position that I mentioned. Um, so that just to help the patient as they recover. So fainting, bites, stings. So for fainting, this refers to just a temporary period of loss of consciousness. Now there are different things that can bring that make one faint, especially the elderly ones. It could be down to standing for a while. Standing for a while. It could also be down to the fact that they haven't had anything to eat for a little while, or as a consequence of the medications that they are taking, which can make them feel dizzy and faint. So if someone has fainted, if you were there um, it, prior to that and you saw that happening, you may be able to help the elderly one and slowly, uh, safely also lower them to the floor or to a bed or a chair. Allow them to rest a bit and lie down. Usually they recover within a few seconds. Once that's finished, please seek medical attention. You need to find out why it's happened. You want someone to be able to confirm that it's a simple faint or it's a faint due to something else. You don't want to be sitting on something that can potentially be a problem later on. For bites, so we can have sustained bites from animals, from human bites. Like I said, my grandmom then would go to the farm with her pair of slippers, and they may sustain a bite from the snakes and things like that. If these things happen, if you have a bite or someone gets into, no, obviously they won't get into a fight, but um, a, a mad person stumbles upon them and bites them, so a kind of a human bite, you want to clean the area with soap and water for at least 5 to 10 minutes. The idea is to get as much um, bacteria out, as much debris out of the wound. And then the reason why I've put down seek medical attention is that bites from humans and animals often get infected because of a lot of bugs that we humans and animals harbor in our mouth. So they would usually need antibiotics. In some cases, they would need tetanus toxoid. Okay, so for insect bites, use antihistamine cream, soothing cream, or you can use simple Vaseline. Put some ice and avoid scratching the area. You also have to look out for signs of infection from the insect bite. It doesn't happen all the time, but the sign of infection will be you noticing a lot more redness around the area, and then also noticing more swelling and pain. For nose bleeding, there are different reasons why someone can have nose bleeding as they get older. It could be due to the medications that are taking, something like aspirin or something like clopidogrel, or also just that as you get older, the inner part of the lining of the nostril becomes frail. So by forceful sneezing, you may bleed. So if someone, you notice your elderly one bleeding, stay calm, uh, pinch their nose, ask them to pinch the soft part of their nose and lean forward. Please do not put your head backwards if you know, because they will swallow a lot of blood and that's not recognized. You can apply a bit of ice also at the bridge of the nose. If your loved one has bleeding lasting for more than 10 to 15 minutes, ask for help, take them to the hospital. Okay. For choking, if someone feels that they look like they're choking and they're giving a sign or they can talk, then that means their airway or breathing has not been compromised fully. I advise them to cough. They may be able to dislodge the foreign body while they do so. If that hasn't helped, you can do the backstroke. So backstrokes would be tapping them at the back between the shoulder blades. Five parts or strokes may help dislodge it. If that doesn't happen, you can repeat that immediately afterwards. If that doesn't help, then you may have to go to the Heimlich maneuver. Heimlich maneuver is the next slide. This slide where you have to put your hand just on top, go at the back of the patient and put your formed fist just in the upper part of the abdomen and do some maneuver. That might prove very vital at that point. Thank you. I guess just before I round up, the key thing to I would say tell everybody is practice makes perfect. If you don't have the opportunity to practice this because you've not had your loved ones in this sort of scenario, please go through the slides as often as you can and uh, commit things to memory because they will come in handy. Thank you.